Wait. No, it's not wait.
It's height.
Height. Guys, you're not listening. I'm going to do this once and for all, and you have the rest of the time to practice. You're not listening. Miss Davenport, please get up. Can somebody wake Miss Davenport up? Get up, get up, get up, get up, get up. Yeah, no, I want you to sit up. I want you to sit up. Thank you. All right. So the same thing we did for the respiration and the temperature, when we bundle them for the height and the weight, we're going to do the same thing. So look on the weight, the height. The height, you see, knocking the door, introducing yourself, explaining the procedure, similar hand washing. So item number 1 through 4. You guys see item 1 through 4? You guys see that? Yeah. Okay, so 1 to 4. Okay, so it's talking about the same thing. So when you go to number 5, there's a difference in 5. What do you see in 5?
Non-slip shoes.
Okay, for no-skid shoes. So you want to make sure you verbalize that, okay? So anybody been in the hospital, you see the socks that they wear in the hospital, the yellow socks or the white color with the thick plastic, you see that? So it's non-skid, so you have that so they can fall, because so when they fall, when they get down, it has a grip. So all you saying with that is you're not going to come and look at the person's phone and all of you. You just verify, my patient is wearing non-skid shoes or mosquito is wearing non-skid shoes. Okay? But you have to verbalize it. Non-skid shoes. So you don't want shoes that's like a slippery socks that the person get up and they fall down and break their hip. Okay? And if it's an elderly, it can be the cause of the death. Yes. Non-skid.
Can I say non-slip?
What is this here?
Yeah, but I'm gonna be.
Why you guys laughing?
Scared.
Hold on. Why you guys laughing? Huh? Non-skid? No, don't say it. Don't be afraid. Non-skid. So how you say it? S-K-I-D, right? Yes. All right. It's an emotional thing to talk about, so let's just bring that. All right, yeah. All right. So that non-skid shoes, okay? Because why I say it's emotional, the first patient that died with me was an elderly lady. She fell. Hunter, you guys not listening. You guys, she fell and she died. And most importantly, in 2020, I told you guys my mom died. She fell, and then she just went downhill from there. So that's a big deal. All right. So you want to check that non-skid shoes. Instruct the patient to stand directly in front of the skid, in front of the skill. So you want to make sure. You want to. It's not gonna be a funny on Monday. You want to make sure. Listen up. I think you guys got this, right? Because I'm trying to get through this so you guys can have time to practice. Dodo is standing this way. So another thing that you want to make sure. Number 7. Look at number 7. So what is she doing wrong? Mr. Davenport, get up. I want you to be up. What did she do wrong right now? You got to put it up prior to the person getting on the scale. If you don't put that rod up before they get on, you lose how many points?
3.
No, not 3.
1.
1. So you instruct the patient to stand directly on the center of the scale of assistant. Miss Jelly. You guys not watching, listening to what I'm saying, and you guys gonna lose points for that. And then you, after you do that, you go in and you measure, and after you're done, I'm gonna give you time to practice one. Go through it, and then after that, you read it. After you bring it down, you measure it. You're gonna leave it there, and then you finish the procedure. And you're going to say, assist the patient. I'm not going to direct you back into your room in the same position. You please sit down. Okay? She's not in her room. Are you okay? Are you comfortable? I'm going to wash my hands. Since you're comfortable, I'm gonna go wash my hands and I'm gonna record your result. Is that okay? So you see that, okay? After you're done with that, you're done with our skill. Now you're gonna bring them back on their way.
Then do I step basic?
You want me to follow?
Step on something.
So look at number 5. Look at number 5. You already talked about non-skid shoes. So if you say the previous thing, you get credit for it because it's the same episode. We're bundling this. So if you didn't say, remember that. If you didn't verbalize non-skid shoes in the first one, but you say it here, you're gonna get point for this one, but you don't get it for the other one. But if you say it for the first one, it rolls over. Because you're done with that skill. That person may have already fallen, so I can't give you credit for that. Guys, listen, it's not funny. I'm telling you why it is. Because if you didn't check that person the first time, so you already passed through that, you already filled the clinical scenario in that. So if you say it up front, that means you've already checked up front. So it rolls over. If you don't say it the second time, we already agree it will roll over. Okay? So if you say it the first time, you don't get penalized. But if you don't say it the first time, but you say it the second time, then you catch yourself, and now you will get credit for this time. But you already failed the first time. If you didn't wash your hands the first time, but you wash your hands this time, you already given that person that germ. You remember that video with the halo? Okay. So now, after you do that, on this height, you have to put this up. What do you have to do before the person gets on the scale? Set it to 0. Okay. So nobody should miss that. On number 4. What is it saying there? So you're going to simulate washing your hands still, because you want to, before you start touching that thing, so you just start wash my hands and you go through that. And number 5, what is that? The void. What void mean? Yeah, see, this you don't have to, you can say that, or you can say, would you like to use the restroom before we get the skill? Why do you think you do that?
It holds weight.
Not a way.